Perfect. All right, so once again, everyone, my name is Ashley Klein-Jimenez. I am from PreventConnect, and you are here for our web conference today on harnessing qualitative data to advance health equity. PreventConnect is a national project of Valor US, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or Valor. So as I mentioned a few minutes ago, we decided to do a two-part series on data. And so the first session that we did was a couple weeks ago, and it was looking at data sharing and integration. And it was a really interesting conversation. If you weren't able to attend, we do have the recording available. But something that came up in that conversation was this notion that an important use of data for preventionists is to tell the story of our work. And we know that compelling storytelling using qualitative data can make the case for prevention in a way that can really move people and get buy-in from funders, stakeholders, and cross-sector partners. I don't know if you all are seeing what's happening with a particular movie that was recently released on human trafficking, but that is an example of someone using storytelling. And I have a lot of thoughts and feelings about the particular use of that storytelling, but what is happening is that people are talking about this. They might be talking about it in ways that, we have feelings about, but it is being talked about. It is striking a chord. It is striking an emotional response. And I think that is something very interesting that we should probably be paying attention to as prevention practitioners. So our objectives for today, and then I'm really excited to introduce you to our guests. We do have a couple objectives, and that's really to understand the importance of storytelling in public health research. It's to think about the ethical considerations for collecting, understanding, and communicating about qualitative data. Think about how we put the effective strategies for gathering this data into practice, and then to align the research and surrounding engagement efforts with targeted, movable policy problems, which sexual and intimate partner violence and all of the root causes are very much related to. So with that, I want to introduce you to our guest today. I'm sad to say that Jacqueline Blocker, the Director of Data and Policy for Metriarch, had an emergency this morning and so is not able to join us. I am going to share a link to a podcast so you can hear from Jacqueline herself, but we're super grateful and excited to have Caitlin Beasley, the Policy Engagement Manager at Metriarch, join us today. And Caitlin, I think the first thing would be to ask our audience today, if you go to the next question, just what are you hoping to get out of this session? What skills or knowledge are you hoping to build today around this idea of harnessing qualitative data to advance our work? And so Caitlin, we'll keep an eye on what people are saying in the chat, but I'd love if you would maybe just kind of share with us what Metriarch is. Janae and I have done some research and we've talked to you, so we know that if you would share with our audience who you all are and what you do, that would be amazing.
Absolutely. And I also just want to get started by sharing a little bit about my personal background, because I'm really excited to be here. I came from the local domestic violence and sexual assault agency here in Tulsa before I moved to the policy space. And so it's really cool to be here with, I don't know, it feels like my old job a little bit. I miss folks in this space. So really excited to be here, and really sad that Jacqueline couldn't be. But she's an incredible leader, great advocate, and also was a practicing attorney for a while. And as you learn more about Metriarch, I think you'll understand why that is a pretty cool asset to have in the work that we do. So I think I can advance the slides. That's nice. Okay. So I guess just to start off, we already kind of talked about the title of the session, but kind of the top title, data, empathy, and change. And I made change really big because I think that is really, when we analyze data and we think about how to present it, that's really what we're after. So with that in mind, a little bit about us. We are Metriarch, an Oklahoma women's public health think tank, which I still get tied up in my mouth whenever I say it. Our goal is to normalize and broaden conversations about women's health in Oklahoma. A tall order, but it's been a really rewarding thing to be involved with so far, and I'm excited to tell you a bit more about kind of how we do that. So a big piece of our work is policy and legislative analysis, and that's something that we do a lot of during the legislative session, which here in Oklahoma runs from February to May. We monitor legislation as it is proposed and makes its way through our chambers. We analyze that policy and we work with folks like you to understand impact, right? So we're watching it. We can understand how it plays into like the statutes here in Oklahoma, what it means from that perspective, but understanding the impact of some of that. We work really closely with a lot of our interpersonal violence and prevention kind of infrastructure here in Oklahoma to do that. And then we facilitate relationships and I guess like empower folks to feel comfortable talking to lawmakers and lobbyists, just kind of helping navigate that landscape, explaining a little bit like kind of what maybe 501c3 or being in a state agency, how do you do that when you're in those positions that can kind of feel kind of awkward. So just kind of connecting you with those folks so that you understand kind of how that works. And it's not nearly as scary as you might think. And the second piece, and we do a lot of this in the off season, which I struggle not to make jokes about it, but they will not go home this year or last year in Oklahoma. Like they've extended into special sessions. So we're still monitoring that. But normally in the summer, we would really be honing in on our data research and engagement efforts more. So throughout the year, we do like that news circulation. And then we also do a fair amount of research, which is what I'm going to talk about today, how we do some of that. And then kind of in line with that, we're tracking data that other people are keeping and disseminating it, because a lot of times I think it can be hard when you're boots on the ground doing the work to keep track of all of this other crap that's happening that's going to affect it. Yeah, and then I think just going to our website will help learn bits and pieces and the actual things that we do, what that might look like. But today we're here to talk about research. Before we really dig into it, though, I think it's important, and I'm probably speaking to folks that already understand this, but when we talk about health, women's health, we're really talking about whole women's health. So sometimes when you say women's health, people either think straight up, they go straight to uterus stuff. But even if we get beyond that, breast cancer, maternal mortality and morbidity rates, bodily health. But even going beyond that, we need to think about it in terms of the social determinants of health. So the external factors that affect those outcomes, economic ability, education, transportation is a great example too, that's top of mind right now. All of those things that really impact those health outcomes. So our mission seems a little bit narrow, but when you really pop it open, we're tracking all kinds of legislation from, the establishment of our maternal death review committee and all the way to trying to build public infrastructure so that people can get around our state a little bit better. So Jacqueline does such a better job of explaining that, but that is my version. So getting into the research portion of this, this is probably going to be a review for a lot of folks, but I think it's important that we talk about this to start things off. Data, when you first start to learn about data analysis or research, they kind of divide data into two different camps. We have quantitative and qualitative. Quantitative, those are your numbers, things that you can quantify. Does a great job of answering what, who, and how much or how often questions. And it can give you really good insight into relationships between different phenomena or variables, so correlation and causation. It does a really good job of kind of pinpointing more generalizable insights and then also defining kind of the breadth of a problem. How many youth in our state are taking comprehensive health education classes in their high schools? You can answer that question. Qualitative, on the other hand, is your linguistic type information. It can't really be quantified, or it can be, but might look a little bit different. It's more like language. It does a really good job of answering how and why questions. And it adds nuance to those who, what, and how much / how often. Kind of fills in some gaps that those might leave. And it does, I think, and to speak to what Ashley was saying earlier, for good or bad, creates opportunities for meaning making and actionable empathy. And that's something we'll explore a little bit down the road. But, you know, being able to really understand the context around something, to feel like you're talking to another person. Unfortunately, it can't be plugged into Excel and made into graphs. And so I think that's why sometimes we don't work with it a whole lot. But I think the big takeaway from this slide is you have to have both, really, to tell a compelling story.
Thank you so much for that, Caitlin. I mean, I really benefit from a slide like this because it's a good reminder that there are different types of data and there are really important ways that they can work together to tell that story and to connect to our different audiences. So we're going to launch another poll so we can get a little bit more information about how everyone joining us today is using quantitative and qualitative data. But before we do that, we did ask what you all were hoping to get out of this session. So Janae, I'd love to see what you saw coming up in the chat. If there are any themes or anything specific that you want to share with Caitlin.
Yeah, thank you, Ashley. I'm seeing so many great things coming up in the chat, and it's a lot of what we were talking about just a few minutes ago. I mean, hearing how to use qualitative data to tell the story of the impact of violence prevention programming. I saw using data to speak to potential funders and policymakers, which helps shape the work that we do. How to evaluate qualitative data. You know, I was thinking about that. I put that I really am excited to fuse creativity and data, because I think that oftentimes we're collecting data all the time as preventionists, and oftentimes we don't necessarily know that we are or know how to record it every time we have a conversation with someone. Building data databases, a better understanding on data collection, to do more research in the field about communities. We saw some community embedded and collaborative approaches, a lot of excitement about engaging with communities and using qualitative data to do that. So a lot of excitement about this. I think people are ready for this conversation.
Awesome. I'm ready. Yeah.
Yeah. Cool. I was going to say no pressure. No, these are all great things, and you know, I think that the conversation that you're going to take us through today are going to spark more conversations that we can bring to this space. So super excited for the interest. So Janae, if you go to the next slide, we are going to launch another poll. And let me get that up for you all. So we're looking to ask you all, are you using quantitative data, qualitative data, or both? Okay, so there's there's 4 answers. So we'd love for you to just respond to that. I am going to give a few more seconds, try to get to about 70% of our audience participating. And if you're not using data right now in your work, that's real. And so that's an answer. And please,
data don't know her, Ashley, that you put that data don't know her.
Yeah, you know, gotta just liven the data conversation up. Okay. Wow, we are almost at 80%. I'm going to go ahead and end this poll, and I'm going to share it with you. So Caitlin, it is exciting to see that the majority of folks here today are using both quantitative and qualitative data. A handful of folks are just using quantitative. There's one person who said they're only using qualitative, which is very interesting. And then we've got a few data don't know her. Guess what? You know her now. You know data from this web conference. So yeah, I'm going to go ahead and stop sharing that. But thank you all for participating. That gives us a nice a nice baseline. I think there's a follow-up question to that, which is a text chat question. So for those of you who said that you're not using qualitative data, or maybe you are, but just not as much as the quantitative piece, why? What is there a barrier? Is there a lack of qualitative data that you have? We're just interested in knowing kind of, what is keeping you from using qualitative data, or qualitative data to the degree that you would like to. So we'll go ahead and let people respond to that. I think, Caitlin, if you want to continue, we'll kind of keep an eye and see what's coming up and report back in a few minutes.
Awesome. I'm like resisting the urge to read that instead of do what I'm supposed to be doing right now, which is presenting. So it sounds like if a lot of y'all are using qualitative data, and you're probably, this is redundant, this slide in particular, but I was prepared to convince you it was a good idea. But people hear statistics, they feel stories. So you can put a bunch of numbers together in graphs, but it doesn't feel very human. And this has been proven. I mean, they've done studies on this. Stories make your data more compelling. People remember it better. They tend to be more open-minded when they're engaging with a narrative. It feels like talking rather than just being talked at. And because of that, they're more likely to take action. And I think this is a really important bit. Any kind of public health data, including anyone working in the DV or SA space, it's uniquely well suited to storytelling, because I think it's easier for people to wrap their heads around this. These aren't just numbers, these are humans. They represent our people, our communities, our history oftentimes, health, and journeys through all of those things. So yeah, it works. Well, it takes a little bit more usually time, and usually that means money as well, but I think that it tends to be more impactful on the back end. So we're going to talk about how to do this through some new research, and actually y'all are my first people that we've talked externally about this research to, so hope you feel special. But it was on pregnancy and substance use in Oklahoma. So probably don't need to tell y'all that the public health community, medical folks are pretty much in alignment, because the data shows that people struggling with substance use, if they receive timely, non-judgmental care, the outcomes are better. I mean, it's pretty cut and dry. But often, and this is not a uniquely Oklahoma problem, policies and procedures surrounding it are inconsistent. We see, people are reporting through law enforcement, through hospitals. I mean, the statute is not clear on kind of what you're supposed to do here, and you have just kind of a patchwork of kind of people either trying to prevent, trying to treat. It's a bit of a mess. So why is that happening? So framing research, I think this is initially like a great way to think about it before you really dig in, spend the resources and time kind of designing a project. You got to figure out, does it make sense? First, your landscape analysis and stakeholder mapping. So usually when I say these words, people's eyes glaze over, or they like, oh my gosh, no, not again. Especially landscape analysis with public health professionals. I think there's some kind of, I don't know, overuse of the term in that field. But what we really mean by that is reviewing the data that's available and what your policy landscape looks like. There's nothing more annoying than people duplicating work or doing research when that's not what needs to happen. We already have that data. So make sure you understand that data landscape and then your policy landscape. For organizations like mine that are state-based, people think automatically state statute. That's important. But you also want to look at policies that might be affecting outcomes in different settings like hospitals, schools. Where does district school policy play in? What kind of rules in some of these institutions are maybe changing how people are able to navigate them. Situate that into context. So sometimes, you'll have patched, like in Oklahoma specifically, we have sometimes like different things happening throughout the state. It might be working really well here and not so well here. So look internally to contextualize the issue, and then look externally as well. So compared to other states or national kind of statutes, figure out kind of what's going on within those contexts. And then kind of simultaneously while you're doing that, map your stakeholders. So who are the subject matter experts in these areas? Probably you all, and a lot of like what you would be researching, but also there might be other community organizations that you should be talking to, and kind of broaden that. What you might traditionally don't just start with your partners, but then ask them who their partners are. Really get a feel for who all is working in this space and might know something you might not have seen before. And then this one we'll talk a little bit more about to the change potential, but what policymakers are engaged or might be open to engaging. You'll find sometimes someone wants to do a study or help a politician develop a law to propose when there's been a law proposed for the last 3 or 4 years by someone. So make sure you know what's going on in that space. Do we already have someone trying to make change there? And if so, engage with them. What do they need to get that across the finish line? So once you've done that, now you want to really dig in and figure out what your knowledge gaps are. Understanding this is best practice. Here's how we're not quite getting there, even though all these people are doing all these things. Where's the gap in information that we need? Your stakeholders, again, are going to be key in identifying that, what those research questions should be, and also who can answer them. And equally important, who needs the answer and why aren't they already absorbing information that's out there? Because that's going to be really important in framing those research questions and figuring out what is missing, what data might bridge those gaps. And then last one, and this one sometimes feels kind of icky to talk about, but I think it's important, is this movable right now? Because we can see some issues, but there might not be, it might be not the best use of our resources to target some of those things in this moment. So is there movement? When we really dug into this, we found that there had been an influx of funding related to the opioid epidemic that now this is a good time to be doing this kind of research because there's been movement here. Is there an uptick in news coverage? Sometimes that means your problem has gotten so bad you're starting to see negative impacts, but not always. Is there change occurring in a related area? Maybe there's already a conversation going on that you can easily kind of maybe with a research presentation, you can kind of redirect and have, not redirect necessarily, but share that kind of conversation that's already happening. And again, with your people in power that have the resources to make change more easily, are they engaged? Or could they be engaged if they're working in a tangential area? Because you could do all the research you want, but if the people that would be rewriting the policy are not going to listen, that's going to be really, really hard and really demoralizing. So finding that out beforehand is important. So that's kind of how get started framing.
So thank you for walking us through that. I really love that chart. I think we'd love, and I'm going to put it in the chat, to invite you all to think about a gap in knowledge about either how a risk and protective factor, the links between that to violence, or a gap in knowledge about one of the prevention strategies that you're implementing, where some of this framing that Caitlin just walked us through maybe could help craft that messaging or storytelling to educate people. And I'm thinking about, some of the ones that when I'm talking to people about prevention strategies that people have a really hard time making the link to, or things like greening, but even like housing justice, which was a topic in our latest podcast, like how does housing justice relate to violence prevention? So just inviting you all to kind of maybe choose one to think about. And Erin says built environment for sure. Thank you, Erin. Let you all think about that for a moment and maybe pop some of the things coming up for you in the chat. Janae, I did want to just circle back to you and see, I hate saying circle back, but I did it. I I want to see what people were saying about their use of qualitative data. What were you seeing?
Yeah, thank you for circling back. I'd love to touch base on what people talked about earlier. Yeah, Caitlin, sorry, I can't help it. Yeah, I mean, it's a lot of the stuff that you just spoke about, Caitlin, people saying that even though they're having conversations all the time, they don't have the time, funding, or skills like within staff to code that information and use it, so it's like, it's one thing to get the information, but what does it take to actually turn that into something that you can use later? And also the balance between needing to report back to funders, and so the quantitative data getting prioritized because of grant deadlines, but then like how to make space for qualitative data later.
Makes a lot of sense. I'm reading some of this. I'm like, wow, yeah, these are things we're dealing with too. Like, I think the biggest thing is capacity, because qualitative data it takes longer to deal with, or it's not the right way to say it, deal with, interact with, gather and analyze. So I'm hoping that some of the ways that we've been able to do that will help folks. So because people get so annoyed with the landscape analysis thing, I feel the need to describe a little bit what that means. So for us as a policy organization, that was identifying trouble points, and then looking at how, this is one example of how we did it, but looking at how different states are dealing with that thing. And that gives you ideas for what hopefully will be policy recommendations at the end of your research, but it also contextualizes things. And we were able to find out that Tennessee had run a really harmful policy and sunsetted it over 2 years because it wasn't working. We could totally see that type of policy pop up in Oklahoma, and now we have proof it did not work. So kind of, navigate, like looking around you and seeing what other folks have done to kind of guide how you'll present your information, and yeah, just making sure you have all of that before you really start launching into a study. And framing, so looking at your quantitative data to inform what qualitative data would really help build that story. So in the case of what we were doing, the quantitative data told us that number of infants exposed to drugs in the womb is going up in Oklahoma. Admissions to treatment centers are going down. Bad. Many treatment centers don't accept pregnant people. Intersections are really starting to form there, and substance-related incarceration rates are going up, especially for women. Policy landscape analysis told us that Oklahoma's not alone in that there are a lot of like intersecting policies that make it really unclear if and when mothers and infants are drug tested after in the perinatal period. And then substance use during pregnancy is often criminalized under your child abuse and neglect laws. And just, I think one of those really stark statistics that you can say that will, when you pair it with a narrative, this one stuck out immediately. Only 1/3 of the state's substance abuse treatment facilities serve pregnant or postpartum women. And that's in a state that already doesn't have enough treatment centers. So that's pretty shocking. And our stakeholders were telling us there has been this influx of funding in the last few years that fed our qualitative or quantitative data, which is part of the reason we're really starting to see these trends, is because now we're starting to look at them because of that funding. So we don't necessarily need more quantitative data. We have that. And that's scaring folks into a reactionary response, and they're leaning into incarceration. Some stakeholders, and this was like, we're like, ooh, this is a qualitative data problem. Some key stakeholders still did not understand, and this was a caseworker's way of putting it, the emotional side. They don't understand who these people are. They don't understand that substance use is a mental health issue, and not someone, as one of our assistant DAs put it in a recent case, choosing meth over their children. So you've identified this as a qualitative data problem. You've talked to your stakeholders. How do you collect this data? And I think it's interesting. Some folks have been saying they're collecting it just in a lot of other touch points with your population, but you're not using it. So this is if you need to like go in and collect it. But I think it's important to talk about nonetheless. Identifying who you want to talk to. So we talked about that a little earlier with the framing, but who are the people that know the answers to the questions you're asking? And oftentimes that's the people impacted by the phenomenon you want to understand. What are their barriers to accessing the things that they need? And then who is best equipped to reach this population? Because it might not always be you. Working with your stakeholders that the folks that you're trying to talk to already have trust with. And then when you're thinking about how to conduct these interviews, you're finding folks, how do you do this? You want to focus on, and this is really weird, because if you're used to working with quantitative data, you want to do a survey and have people fill it out. Or you want to, even if you have an open-ended question, like people don't like typing into the abyss. You need to talk to them. And I know that is really time consuming, but it's important if you really want those insights. You need to create that safe space, and you need to be a person talking to them. We did that through interviews that we offered either in person or via Zoom. So that's one thing, is the setting, but then also as you design how you're going to do that, getting subject matter expert feedback as you design those guides. And we call them guides because it's not just a list of questions. A lot of it is, here's how to use trauma-informed language when you're talking to people, and really open-ended questions. And as people shared what struck them about that question, you ask more probing questions. And we're really privileged to work with an anthropologist who did a lot of these interviews and developed these guides based on best practices and how to kind of structure interviews made to develop that understanding of lived experience and an emotional landscape. It's kind of high level how that works.
Caitlin, real quick, there was a question in the chat from Ryan asking if Metriarch, do you all have interview guides that yielded meaningful results?
Come again, what was the last part?
That brought out really meaningful results in the questions. Do you have that as like a resource or a tool?
Yeah, we should be able to share that. It's a lot of like, when I came from the DV and essay space, right? And it was a lot of that trauma-informed guidance. And then also, we can share the questions that we asked. And granted, they're particular to the folks we were speaking to and the issues we were getting at, but I think probably just a broad question, like a lot of us are struggle with that, is how do you ask that in a way that is safe and also isn't so broad someone doesn't know how to answer it. So yes, we can definitely share that. Okay. So want to pause here for a moment and talk about ethics. We struggled with where to put this slide because it's so important, but we didn't think it would make sense until we kind of talked about developing those questions. This should be woven throughout the process, and your stakeholders, again, are going to be key in helping you make sure you are doing your due diligence here. So you'll involve them in that process. And ideally have them like review your guides and stuff and tell you that's not going to work or that's not right. And you need to think a lot about how your research community is vulnerable. So for us, we know incarceration rates are going up for people who use drugs while they were pregnant. So criminalization was a huge one for us. Making sure that we were considering that. We were making sure their data was secure. For folks working in interpersonal violence spaces, I think re-traumatization can be really important. And I thought about this, like if you're working with a lot of youth, that's another thing to consider. How do you keep young people safe if they're participating in something like this, and dealing with the whole like parental consent piece would be interesting, but I digress. That would be something you would think about though. And then you have to understand that qualitative data can never be 100% confidential. And that's hard. So how do you create that safety? Things have to be anonymized and kept confidential and safe. But then it does raise this question of, a lot of times that looks like data aggregation, but you're taking words, right? Someone said these words. It's more linked to an individual person. So spending some time and doing some reading, which we're happy to provide if you are interested in kind of exploring that, but spending some time thinking about if you're aggregating data using pseudonyms, that kind of thing, how do you find that balance between preserving and protecting someone's voice? You need the authenticity of their experience, but you also need to protect them. So we'll show you a little bit more about like what that looks like in practice, but something to think about as you're designing your questions and talking to folks. And then case study, kind of how we did it. Split our target population that we wanted to talk to into two groups: people with lived experience with the issue that we're looking at, and then also those working directly with those folks a lot in a professional capacity. We identified participants through stakeholders, networks, and targeted communications, so individuals could sign up to participate. As I mentioned, interview guides, crafted those, and we had our folks that knew, like, were really working with folks every day, review them. Informed consent, and I don't want to get too into like the nitty-gritty of like building a study, but informed consent is hugely important. And then also not just having the document, but explaining it, letting them read it beforehand and making sure they understand is important. And then compensate your participants. And I know something I've seen, something especially when I was working at the agency I was at, financial resources are extremely limited. So I know that that is not an easy one, but these are people sharing a lot, especially if it's someone that experienced violence. It's re-traumatizing. So, you know, compensating your participants for their time and energy is really, really important. So I think this is probably, if you could take one thing away, the most important part of like, just as far as like takeaways, how do I do this? Because I think this is what a lot of people get hung up on with qualitative data. How do you analyze it? So I have all of these interviews, all of this information, and I have consent to use it for this purpose. I've got a bunch of words. I don't know how to make sense of them, find the themes in them. So the first thing that you need to do is transcribe. If you have intern help, that can be beneficial, but I think software can really help as well. And there are some that aren't very expensive or have like free trials that you can definitely take advantage of. It can be kind of cumbersome, but it will save you a lot of time. But you need those transcripts because what you're going to do after that is take notes, annotate. And this is a little bit of you have to kind of open your mind a little bit and just kind of let connections happen. But, you know, as someone that has been working, that maybe has been doing some of the interviews, highlighting important passages, oh, I hadn't thought about that before, or, ooh, that really answers that question in a way that I think will be important. It's kind of what stands out, why, and what does it tell you while you're researching? And then you're going to, after you've kind of read through, identify and analyze some major themes that you see keep popping up, because that's what you're looking for, especially things that you don't already know or the data is not already showing. And then comparing those themes across the data set. It's only happening here with some of our participants that presented this way, or it's only happening in folks that were in this certain area, or this is happening across the board and are, you know, how and why maybe could that be the case, that it's happening everywhere and no one's talking about it outside of this particular group. And then this is when you're going to want to look at your quantitative data again, because that will help you make sense of what can sometimes feel kind of like an ambiguous, difficult process. And here is where I think, again, we have software support here. And this came out of for-profit, when they would, like, you're trying to figure out, like, oh, do people want this product, or what, you know, what might be marketable. There's a lot of software out there that has been used to analyze verbal communication or transcripts. And so we have used both Dovetail and Atlas TI to do that. Dovetail is really easy and it's not that expensive. And I'll show you a little bit what it looks like here in a minute, but that takes some of this difficult ambiguity out of working with qualitative data. So I highly recommend, if you're developing a research budget, considering adding this into it. It really allows you to work with qualitative data in a more meaningful way.
Caitlin, there was a question about AI software. And the question was, are there any confidentiality considerations using AI software for transcription? So like where the data is housed, etc.
You definitely want to look into it. Make sure that the policies, especially if you work in a state where they're criminalizing, you want to find out, this is something that we did, find out kind of where some of these companies are based, because that can affect whether they might participate in, especially if you're working with a population that's criminalized, if they will participate in some of these things. That's a great question. That's where the ethics comes in too. I love that. And interestingly enough, like we had some of these programs will generate like automatic thematic groupings. And we found that some of the software was using really problematic language for folks using substances. And so we ended up like sending a letter or like a little comment to them like, hey, maybe you should update your algorithm here. This is not best practice language for this. So yeah, AI is tricky and it's so new, it is scary. So I love that folks are thinking about that. This is just kind of what it looks like. We use Dovetail for this project to make notes and annotate our transcripts. And it does some of it on its own, and then you kind of have to come in and correct things. But you use a tagging system, you read through your transcripts and you tag things based on what they're talking about and where it might connect to larger themes. You color codes, it makes it a little bit easier to understand. And then it has a lot of data viz options that will help you kind of see how everything is connecting. And I hate that initially our research, the one who's been doing a lot of the analysis was going to be able to join us, but she's on a plane from Amsterdam to the US right now, so couldn't make it today. But if anyone has any more in-depth questions about this stuff, I think that Eliza would love to talk to you about it. So that's an open invitation. All right, so you have the data, you have organized it into themes. Now, how do you present it? So we talked a little bit earlier about aggregating data to protect identity. So using those insights that you gathered from the analysis portion to create, we have had so much success with personas, which are, embodying those things that you're seeing and humanizing it again. It's really weird. It's like goes from human to pulling stuff out, like kind of de-aggregating and then re-aggregating back into human. Kind of an interesting process in that way. But you really want to answer, I think, in our experience, it's been 4 main questions, like who are these people? And humanize them at this point, like name and image, it's a person again. And then kind of give a little bit of a background as to who this person is based on what you're seeing in your larger data set. How do they think and feel? So that emotional landscape we've been talking about, briefly describe that. What are they afraid of and what motivates them? And how do they make their decisions? What kinds of things lead to those things? What do they need? This is probably 3 and 4 the most important when you're thinking about change and your policy recommendations. Safety needs that they have, or social needs, resources, because understanding that need is going to be really important for providing support and fostering well-being. And what barriers? So understanding their frustrations, obstacles, what are they running into that's preventing them to get what they need?
Can I ask a question?
Yeah.
Can you go back to the other slide really quick? So you're gaining data from this group of people, like your community, and then you're creating a fake person that represents most of the data of that group of people to represent to other people. Like, for example, Maria lives in this town and her issues are this, and that. She wants this, but this is why she can't get that. This is a typical person of this town.
We probably wouldn't put the specific town, but you're on the right track. Like, and usually
Okay.
we have a big data set, and then we identify 4 or 5 people, because a lot of times you'll have different types of I guess trajectories or journeys is probably a good way to put it. But yeah.
Okay, and that's to like basically tell the story you were talking about to the policymakers?
Yes.
Okay, interesting, thank you.
Yeah. That way we can kind of give them that voice without exposing them. And then you pair it with your quantitative data, like here is Emma, and here are 3 stats that prove Emma is far from alone. So then you get your depth with your qualitative data and your breadth with your quantitative, if that makes sense. Here's an example of a persona, which I think will probably help answer kind of what that actually looks like. So I'm not going to read this whole thing to you, but just an example of what this can look like in practice. And I think giving that imagery too is really important. Like you're imagining this person, this real person, as you're reading kind of the aggregated analysis of an experience that is happening. And then adding those quotes in is so important. Pulling a couple of little bits that do not have identifying information in them that help make what you're describing, and especially your needs or your barriers, feel real, because it is real. But a lot of these people, a lot of people that where the people that are experiencing that knowledge gap, that are creating some of this policy, they're not seeing them as real. They're seeing a problem and they just want to fix it. They're not thinking about the people experiencing it. So that's what this qualitative data can kind of do, and these personas can kind of do. And something else we're working on that we didn't quite get ready for this presentation is like jury mapping. So then we might take Olivia and show how she navigated through different parts of the system where she faced barriers, so you can kind of see how someone actually experiences some of those barriers. So that's like in the next couple months, we'll be working on those. Yeah, but that's the meat of the presentation. I think the only other slide I have is thank yous. So how am I doing on time? Ooh, barely.
No, Caitlin, I have a question. So with something like, Olivia's story, how would you then present that? Is it presented like in conversation? Is it presented as a written document? Is it like what does that look like?
So we definitely think about this kind of thing in terms of like, we want to create it in a way that it can be, what's it called? There's going to be a final report, but we're also going to break that report up into little bits that we can share with different audiences. We'll put it on social. When we have someone go into the Capitol, we'll have brief one-pagers that maybe just have one of the personas and some data on them. You want to make your whatever it is that you're setting modular, where you can have like, okay, knowing this is the audience, here's the quantitative data we need to bring, here's the qualitative data we need to bring, and it has to be brief, because most people don't want to spend, probably most of us on this call are nerdy enough that we would spend an hour and a half reading a report, but most people won't. So that's something else to consider, is how can you take bits and pieces, highlight bits and pieces into short little digestible components, if that makes sense. So we'll be working on that a lot in the next few months too.
Yeah, that does make sense. Another question that I had was, so in crafting like this persona, for example, so this is coming from the people who are experiencing, in this case, substance use during pregnancy, but it's also coming from people who are working with that population, right? So to tell this story, you're drawing both, I guess, experiences. Okay.
Yes, and
that makes sense.
Particular one, like that's an interesting. We might put the persona of a social worker or someone in this, like a DHS worker, I could see that making sense. I think it would depend on the audience, but you can still, even if your personas are the people with the lived experience, you wouldn't obviously put like one of the people working with them, you wouldn't put one of their quotes in here, but it could certainly inform on barriers and how thoughts and feelings and that kind of thing.
Mm-hmm. Right. Okay, that makes sense. Thank you. I want to go back to Janae. Janae, are you still with us? And just see if you saw anything coming up in the chat. I know there's been a lot of conversation and resource sharing, which is really exciting. And then we also wanted to take some time right now. If you all have questions for Caitlin, this would be a good time. I know we've asked some as we've gone through, but if we just want to, if you want to engage in more of a conversation around this and how it applies to your work, that is our time for now. But Janae, what were you seeing?
Yeah, thank you. I saw one comment, I can't remember who put it, but they made a really great point about some of the gaps sometimes in qualitative data collected in academic settings, and that people working within the sexual and domestic violence prevention fields are uniquely positioned to be able to collect data in a trauma-informed way and still see the big picture. So I really appreciated that perspective of seeing all of us, seeing ourselves as storytellers and rethinking our role in that. I think when I was working at a local rape crisis center, that perspective would have shifted the way that I do things and when I go in and implement programs. So that was really great. I see a lot of people sharing links, so thank you for that, for interview sheets, and NSVRC has some really great resources in the chat as well on data and storytelling. But we would love, if you have any questions for Caitlin, you can raise your hand and unmute yourself or throw it in the chat.
I'm sitting here thinking like some of the resources people are sharing, like this isn't done yet. So if you have like examples of how other organizations have done this, or recommendations for why didn't you think about that, or I mean, that's something else too that I don't know, I'd ask Ashley and Janae, like I don't know if you can keep a track of this log or whatever, but feedback or recommendations for, it's really exciting.
Yeah, and we will go through the chat after this web conference and send out a document with all of the resources. So if it feels like the chat is popping off and you're not catching them all, I know I miss some of them sometimes. It happens fast. We will be sending those out. I think I'm wondering, so let's say that someone is listening to this and they're feeling really inspired and wanting to take this back to their organization, but maybe it's never been done at their organization. Maybe they're a middle manager, and they have to create some buy-in and create some structure for how to collect qualitative data. What does that look like in its early beginning steps of an individual wanting to take this and embed it in an organization?
That is an awesome question. And when I was at the DV organization, DVSA, it was something that I did. It was really hard. And it took a little bit of persistence, because I think, especially if you are responding, this kind of stuff feels, this is not important. But I think, I don't remember if it was Ashley or Janae, one of y'all said, Janae, if I had thought of myself as a storyteller, so starting with internal people and talking to them, maybe doing something like this with your staff can help them understand what this means. And then I think getting rough numbers on what some of the resources you might need. How I ended up kind of selling it was, we had an intern opportunity, like a local partner organization was wanted to place an intern with us, and I kind of laid the groundwork, and I was like, ooh, I have a project. So it didn't have to be, we had the woman power in this case to do that, kind of how I did it. I think starting with your internal customers.
That's really helpful. Thank you. I have another question for something I saw in the chat earlier, but I saw that Laura put a question in the chat, so I'd like to uplift that first. So Laura is asking, can you speak to how you think about the photos and images that get shared? So creating those personas with stock photos, what goes into that with intentionality? And like, what are some of the considerations that we need to keep of like, you know, perpetuating biases and, you know, the kinds of personas that we create?
That is also an amazing question. And we are definitely still working through that right now. I think one thing we have thought a lot about, so initially, because if you Google a pregnant person, usually like they're only looking at the belly, and they're in some weird, really well lit room with a bunch of like, it's clearly like a wealthy person. Like, you know, who are these people? So it's hard to find like that look like your people that you're actually talking to, but aren't those people. And it's been hard, honestly. And something else that initially I hadn't thought a whole lot about is a lot of the folks in this study already have children. So it's not a pregnant woman in her belly, it's a pregnant woman in her belly and her other children, because they're also part of this story. So I think at this point, I appreciate the question, and we're going to continue thinking about it first off, but I think making sure that what images you're using reflect the population that you've been talking to, ground in that. And again, like a broken record, talk to your stakeholders, the people that have really been helping inform a lot of pieces of it can also help with that. But yeah, it's tricky because you don't want to expose your people. You can't use their pictures.
And I think the acknowledgement of it being tricky is also really helpful. I see Caitlin has a response, and then I will go to Ryan, and then I have another question for you. Yeah, Caitlin's uplifting photo voice, which is a project that often gets used in the coalition space. So Ryan, I think you have the option to unmute. Do you want to ask your question? And then I have another one for you, Caitlin.
Yeah, I was just wondering if you have some materials that, you know, from other organizations that they've already found to be useful, and then maybe we can use that to get some buy-in from our organizations.
Like you're thinking materials around doing this kind of research, or?
Yeah, like, so let's say organization A has already done some of this research and they've already put together some kind of qualitative report or poster, or whatever you want to call it, infographic, and that's been, you know, met with some approval by whoever their stakeholders are, and so they can share that with us, and we can say this is like an example of what the output will be if we invest a little bit in this.
Yes, definitely. And I remember when we first got started, I have a little folder in my drive of example, like this is what we want to do. So I have that. Can definitely pull some of that together and share, I guess, in the resourcing it's going to go out.
Great, thank you.
Absolutely, great question.
So another question for you, and I keep seeing ones coming in the chat, so this is exciting. When do you think it would be appropriate to use exact quotes from an interview or focus groups or surveys?
So I think you have that informed consent, so people understand that it will be deaggregated and that there will be no identifying information, but they do understand that direct quotes might be presented. Like we made sure that people understood that. I think sometimes too, I had a couple of interviews that I conducted where I flagged a certain moment that seemed, this is something we did too, if someone had a more emotional response during a certain portion of the interview, like made sure they were okay they knew they could stop at any point. They didn't have to say a reason. But I also flagged those moments because, and we asked them too at the end, do you want us to share the results with you? Like, do you want to see the report? Because sometimes they don't. So I think asking that question is important, and then flagging those moments that clearly are more triggering and steering clear of them. Making sure they understand too, they could be quoted.
Yeah, thank you. That's really helpful. So then the next question that we're seeing coming in is around accessibility. So thinking about those reports, do you have recommendations around alt text or other options for people who are visually impaired? So when the images go up on a report and they don't have alt text, do those exist somewhere else where that could be accessed? And if not, what would your recommendation be?
We have not looked at that yet. Thank you.
I always appreciate these spaces because I feel like I learn so much from our presenters and so much from our people, from the participants too. There's so much knowledge in this space, and that's why we call it a peer learning space. So thank you, Robin.
Yeah, I appreciate that.
Oh, and Robin says it's new for us too. Yeah, as a graphic design girly, sometimes, yeah, there are some spaces where we just need to figure it out. I saw a comment, it wasn't a question, but earlier in the chat that I wanted to uplift and ask about. So I think I saw a comment talking about the recovery time needed after doing qualitative data and all these interviews. And I think they were getting at the emotional impact that has. So I think I would maybe like to ask you, as someone who's doing qualitative research in a DV space, now in a reproductive justice space, do you have advice for longevity and staff retention and policies that promote staff care?
Checking in, this isn't a policy, which is funny because this should be, actually, now that I'm thinking about it, we're a policy organization, we should probably have policy around. But you know, every time we met about the project, we started it with, how are you doing? And really, how are you doing? And then we had 2 or 3 people doing the interviews. And so it was understood that if you have an interview today and you are not feeling up to it, we didn't schedule them in a way that we couldn't rotate if someone were not up to it. So making sure that that was there. Those are probably the 2 practices we had this time around. I do think it's important that as we keep doing this kind of research, we need to think about how to do that even better. Because it was something when I first started working at my last job, I keep talking about it, but I'm talking to my DVSA people again. There was all this, they were talking about, you know, burnout and secondary trauma. I'm like, but I'm not a caseworker. I'm not a therapist. I'm gonna, you know, this isn't something that I should be proactively worrying about. And then I had a moment while I was there, I was like, oh, yes, I do. So knowing yourself and taking time off. And I mean, sometimes after a really rough one, I cry for a minute, take a step back, put it down for a few days. So I don't know if that's a satisfying answer.
Yeah, that's so much. Yeah, thank you. I really appreciate you sharing that. I have also heard of these 4-day work weeks.
Yes.
Yeah, and I see a resource coming out of Rhode Island Coalition. So thank you for sharing. Any other questions for Caitlin? Any comments?
I saw there was a question. Okay, so this is very timely because we've actually been talking about the use of AI, and I am like, I don't understand what it is. Whenever I see like a program that I'm using that has a new AI feature, I'm like so tempted to press the button and see what happens. But I'm scared I'm going to be like sucked into another portal. Anyways, the question is, AI is such a new frontier that we are finding in many areas of our work. Yes. Do you have any resources to find guidelines around dealing with it?
I think that would be an awesome question for Eliza, who is like the research, like the person who kind of, actually, you know what? I should take a moment to say, this is Eliza. Eliza's like our research genius around this. Initially was going to present today and has a lot of that kind of expertise. But I think in this space in particular, AI has been around for a minute. Not to say that it's always safe and you shouldn't be thinking about it, but most of the analysis that especially on the analysis side, well, transcription too, they've been using AI a little bit longer. But it's a good question. Maybe good for a podcast or something. Follow up with Eliza, talk to her about some of that.
That's a great, I'm going to make a note of that. I was actually just thinking about our podcast in this because the software that we use recently started transcribing. And then also I think there's an option to have captions in multiple languages. And I'm a self-proclaimed AI curmudgeon. I recognize this about myself. I think it's because I'm an artist and a writer. I know I have stuff to work through, but I hadn't thought about where that information is housed. And obviously we're a podcast, so it's different. It's not as confidential information, but thinking about who has access to those transcriptions. So I really appreciate that earlier too. I see Cheryl has a hand up.
Yeah, hi. I just wanted to make a comment. I'm a longtime program evaluator and mostly a quant person, but you know, we all do everything. And I just wanted to say that if you have not been involved in qualitative research or research much, and this is something that you want to get involved with, I would really encourage you to, you know, go out there and do your reading and maybe partner with somebody if you don't have the staff that's really, you know, educated about how to do good research design and things of that nature. Even if you can just get, you know, some consultation from someone, a few hours of them throughout the process to help you make good decisions and things like that and help you get comfortable. Because I noticed that a lot of the questions that were being asked are things that are essential to good research implementation about, you know, how do you deal with certain issues? How do you deal with confidentiality? How do you address, you know, certain concerns or whatever it is? And, you know, the more you get involved in research, the more you learn about these things. So I would just really encourage you. I mean, it's great. Doing research is so cool. And, you know, it's a process. And yeah, that's really all I wanted to say.
And we've had a lot of luck there partnering with universities. That's how we're actually doing this now, is with student with advisor, working through kind of academic, we're working with our academic partners to do a lot of this kind of stuff. And if you have policy organizations, think tanks, or I think what else they're called, but do a lot more of this type of stuff, partnering can help there as well. Grad school retron.
Thank you.
Yeah.
Love that. Yeah, thank you for that note, Cheryl. And thank you for going through all those questions, Janae. Thank you for being willing to share, Caitlin. I know, so again, there were supposed to be multiple presenters here with Caitlin, and life happened. And so thank you for holding it down and for being here and allowing us to move forward with this conversation. Just did want to leave you all with a few additional resources, more related to like the practice of storytelling in general, and storytelling about our work to prevent violence. So Janae, would you go to the next slide? I'm going to put some links in the chat from past things that we've explored on PreventConnect, or in the case of the link I'm about to put in, a new resource that we put out, I think last month. There's one more. So just if you wanted to get more information on, you know, what it looks like to think about storytelling about our work. The other thing is, you know, a lot of storytelling and a lot of deciding how to present qualitative data involves messaging and communication. And so I would be remiss not to share NSCRC's guide for reframing sexual violence, which is on the next slide. Janae, if you would go to that. And the link is in the chat. So we will, as Janae shared with you earlier, we will be putting together a resource guide of all of the links that have been shared today, and we'll send that to you all in the form of a follow-up email. It will also be on the website along with the recording of this when it's ready. But we just really appreciate all of the oh my gosh. Wow, y'all. We appreciate all of the engagement today, all of the conversation. Caitlin, again, cannot thank you enough for being here and sharing about the work happening at Metriarch and expanding our thinking around how this all could apply to our work, whether it's through research, whether it's applying to the evaluation that's happening in a lot of this work. It's just been a really rich learning experience. So thank you for that. Y'all, we do have your favorite thing in the world, okay? I'm not gonna leave you without it, our evaluation survey. I know you wait for it so patiently. So I just popped that into the chat. We'd love to get your feedback. And again, just thank you for being here, and thank you for the work that you do. And we are excited to see you on an upcoming PreventConnect web conference, but I think we'll go ahead and end for today. Give you, I also hate when I say this, I'm gonna give you back some minutes. Wow, okay. All right, y'all, we'll see you soon. Thank